You're welcome to Reproductive Health segment with Dr. Ajayi. My name is Dr. Abayomi Ajayi, and we're continuing our discussion on the male factor infertility. We're starting where we stopped last week. Dr. Contd is still here in the studio. So, how are you, Dr. Contd?
I'm fine, thank you.
It's good to see you today.
It's a pleasure to be with you.
I'm sure our viewers also looking forward to hearing one or two things from you. We just start where we stopped last week. We're still talking about male factor infertility. I want us to look at drugs that can have a bearing on male factor infertility. Are there anything like that?
Yes, we do actually have some drugs that can have an effect on male factor infertility. Antihypertensive drugs, yes, commonly it causes that. And what it tends to cause is actually it causes a reduced sexual desire and also a weak erection, such that the person is not able to have intercourse as frequently as they ought to with regards to conception. Then we have some drugs, some antibiotics also, that can actually affect sperm parameters if used for a prolonged period of time. Then we also have, in actual fact, there's a preparation that people have, for a long time, have thought will be of benefit when they are poor sperm parameters. It's a testosterone, it's a hormonal preparation, but it now has a counter effect because it now begins to affect desire for intercourse, begins to affect erection. So what was actually intended to treat poor sperm parameters now gets to cause reduced desire for sex and weak erection. So those are the common drugs that affect fertility.
Yeah. So, but of course, it's not every antihypertensive drug
no,
that
it's
we'll
not.
talk about.
It is certainly not.
So if you're facing this challenge of infertility and you have hypertension, it's better you let your doctor have the full picture so that you can know the drugs to prescribe and the ones to avoid. Very good. Now, the other thing I want us to talk about is there's this thing about staphylococcus. I don't think I can be tired of talking about this because I don't know what your experience is about this staphylococcus. I get a lot of calls, people asking me that they've been treating staphylococcus since they were born, and the thing is not going. What's your take on this?
Well, we should get to understand that staphylococcus, depending on what the type, is a normal commensal on the skin. So if somebody does a test and cultures staphylococcus, how was the sample taken? Because more often than not, this staphylococcus is a contaminant. More often than not. So we have to pay a lot of attention to how was the sample taken before we can reach conclusions from the result. So what I'm saying is this. I'm not saying staphylococcus does not exist, but I'm saying that 99% of the time, it is not what is responsible for the problems that people are attributing to this staphylococcus infection.
So it might never go away, especially if you're not collecting the sample properly.
The proper way, yes.
Okay.
Yes.
Now, one other thing I want us to look at is, when a man has low sperm count, should the doctor examine this patient or this man?
It is wise for the doctor to examine the man, because we also have to understand, at times, we are able to say, oh, this is what is causing it, or this is an associated factor. In actual fact, some people have said that the fact that the sperm parameters are low is a plea from the testis crying for help. It could just be a tumor that is in that testis leading to that. So it could be a pointer to a bigger problem somewhere. And it will definitely be a pointer to what other things you can do to assist this person. So the doctor should do a testicular examination, a penile examination. You could see somebody that has undescended testis. The testis didn't descend into the sac that it's supposed to be in. And then that will be what was responsible. Unfortunately, that may not be reversible, but then there are ways that medically we can get around these things.
Okay.
Yes.
But what is it also proper to do ultrasound scan? Because I know some patients find it that it's not commonly done. When you tell them that you want to do a scan of their testes, it seems odd to them. Is there any value to this?
There is. As I said, the testis could have a tumor that is what is actually leading to the abnormal sperm parameters. The only way you're going to know is if you get to do a scan. If you don't do a scan, there's no way you're going to know. In fact, we go as far as doing that. At times, you need to take a biopsy to further identify what may be responsible and further help us to prognosticate what can we do to help such an individual.
Now, let's imagine a man gets this results that the semen analysis is bad. Either it's low or there is nothing there. It's shattering. To some people, it's like the whole world just comes to a stop. What advice will you have for such people?
For such people, I'll say that the whole world has not come to a stop. There's still a lot of hope. But you start first by some behavioral modifications. If you take alcohol, you have to reduce it drastically. If you smoke cigarettes, you have to reduce it drastically. If you use marijuana, hard drugs, all those things have an effect. And then, those things you do on your own, then you have to need to see a specialist. Because I can tell you there are a lot of things that can be done to help these people. There are a lot. And a lot of people have been helped.
Okay, can we talk a lot for a few minutes about these things that you can do to help them? What are the things that can be used to help these people with either low sperm count or no sperm count at all? Maybe we start with the low sperm count.
With the low sperm count.
Yes.
Well, we'll start with the low sperm count. There is actually a medical intervention that is called in vitro fertilization. This particular in vitro fertilization. And basically what this means is that the sperm and the egg is fertilized outside the body, and the embryos are now introduced back into the womb. This has been a particular type called ICSI. It has practically revolutionized the management of people that have infertility. It has brought hope to millions of people. So that has been very useful. Yes. Then we also have an advance on that is called an IMSI, intracytoplasmic morphologically selected sperm injection. This is used especially when the sperm parameters are very, very bad. And it uses the same technique. The sperm is selected, injected into the egg. We have an embryo, and the embryos are transferred into the womb. It has several advantages on ICSI, and that's been very useful.
Okay. Now the other side is when there is no sperm count at all. We just take that in a minute.
When there is no sperm count, yes. In actual fact, since the sperm is produced in the testes, many times it's because there's an obstruction from the sperm cells getting to the ejaculate. So we go to the testes and we can actually get some immature sperms we can use to fertilize eggs. So that's the situation. But then if the last comes to the last and we go to testes, we don't have sperms, then we seriously have to start talking about donor sperms, adoption, those kind of things.
Well, viewers, you heard it yourself, that there is hope. That's one important thing I want you to get. And Dr. Contd has been able to enlighten us a lot about male factor infertility. And that's where we draw the curtains this week. We'll see you next week.